Hi, I'm Dr. Cheryl Chase. Welcome to Chasing Your Potential. ADHD, or Attention Deficit Hyperactivity Disorder, is one of the most commonly diagnosed conditions in childhood. But the question remains, what do we do about it? Today, we'll be talking about treatments for ADHD. The best way to think about treatments for ADHD is by using what is called a multimodal approach. What that means is we use different ways to address the problem. There are generally thought of 4 modes or ways that we address ADHD in children. They are, number 1, medication. Number 2, parent and child education. Number 3, behavior management. And number 4, school programming and support. The first mode of treatment involves medication. Research has proven pretty clearly that medication is the most effective treatment to address symptoms of ADHD in children. It does work. Now, there's a variety of medications available, and information about medications is always changing. So I strongly suggest you talk to your physician, pediatrician, or other healthcare provider about this option to treat the symptoms of ADHD. The second mode of treatment involves parent and child education. It's very important that the parents and the child understand this condition, that they understand the symptoms, what to expect, the course of the disorder, and the possible outcomes. This will help everyone keep a disability perspective and understand that the child is not choosing this condition or the difficulties that are being caused by it. It's also very important that they understand all of their treatment options and can choose wisely, knowing what is available to them. Understanding the condition and setting realistic expectations is crucial to improve outcome. The third mode of treatment involves behavior management. What does that mean? What it means is that both at home and at school, we need to set up a set of expectations that will be rewarded for the child. In other words, be clear about what sorts of behaviors you want to see more of and what sorts of behaviors you want to see less of. Reward and reinforce the behaviors you want to see more of, and either ignore or do a mild punishment of the behaviors you want to see less of. Be consistent, stick with a plan, and make sure that home and school are coordinated in their efforts. The fourth mode of treatment involves increasing programs and supports at school. The ADHD can have a real impact on a child's ability to learn and perform at school. You may want to increase structure around unstructured times. So when a child is working on a worksheet, he or she is told, do items 1 through 4, and then bring it up to me and let me see how you did. We can also increase expectations and demands at school, meaning that we tell the child clearly what the demands and expectations are and what the behaviors are that we want to see more of, and make sure we reward those behaviors when the child displays them. It's also important that we keep distractions low at school, especially during testing, so the child may do well in a space that's more quiet and private. Kids with ADHD also like to get up and move around a lot, so we want to make sure we give them opportunities to run errands or do chores for the teacher. In other words, rather than fighting them to comply, listen, stay still, and follow directions, we want to work with the ADHD, give them breaks when they need it, let them move around as necessary, and have them sit still and pay attention only for small bursts of time. So, as you can see, ADHD treatment involves a multimodal approach that requires the input from family, school, physicians, and the child him or herself. This is just the beginning of the ways that we can help and treat children with ADHD. For more information, check out some of the resources on my website. I'm sure this information will be helpful for you as you're out there chasing your potential.